Hi, I'm Dr. Babakhanyan. I'm a neuropsychologist and a senior principal scientist with the Traumatic Brain Injury Center of Excellence. My office is actually located at Camp Pendleton at the Intrepid Spirit Center, which is a large interdisciplinary clinic where we provide all types of rehabilitation care for traumatic brain injury or TBI. So as a TBI researcher, being embedded where service members are receiving their care for their injuries is really important because I'm able to get to know the patient population really well. My research and clinical work is focused on improving assessments, treatments, and outcomes for service members who've sustained a traumatic brain injury. So ultimately, our goal is to understand service members' needs, and with the use of science and research, we want to help inform and improve health outcomes. And I work with a team of amazing researchers and clinicians, and we're able to inform each other and be able to do research that is clinically impactful. And so this can be in terms of something more short-term, like their medical readiness and returning service members back to duty and making sure that they're fit for duty, but also their long-term well-being and health. So there's a study that I'm currently working on where we're tracking patients' outcomes that come into a 5-week intensive outpatient program at Intrepid Spirit Center, Camp Pendleton. And so through the use of the automated neuropsychological assessment matrix, which is better known as the ANAM, we're able to track their progress and able to see that when they complete the treatment, they're actually making significant amount of cognitive improvements following treatment. We were able to see that when patients engage in this type of interdisciplinary care where it treats the whole person, we are seeing that cognition, and when we say cognition and cognitive functioning, we're talking about things like memory, processing speed, problem solving. We're seeing in an objective way through the use of this computerized measure that everything is really improving, and it's improving significantly. And part of the reason for that is that when you treat the whole person, so you can imagine when an individual works with a sleep specialist, for example, and their sleep is able to improve after treatment, then cognition you also see improving, and they're able to make gains. And sometimes those changes are really dramatic and sometimes it's subtle. But what's important to note is that even the smallest changes when it comes to cognitive functioning, like thinking skills and processing and memory, even the smallest change makes a big impact in a person's life. Thank you for watching. If you'd like to learn more, visit health.mil/TBICoE.